welcome. So you want your own little bundle of joy. Ah, a cute, healthy, beautiful baby. Now getting pregnant is a gift, a miracle, and it is the most exciting thing ever to happen to a female, more so for the couple. And the happiness is indeed unparalleled. The sensation of the fetus moving inside your abdomen, that sensation has no rivals. Right from getting pregnant to the delivery of the baby should be a smooth ride and should not be fraught with dangers. Smoothing out the 9 months and getting the women to deliver a healthy baby safely is the task of both the women and her obstetrician. So whenever you as a couple decide that you want to go for a baby, go ahead and meet your gynecologist to work out the do's and don'ts, so that when you do get pregnant, both you and the baby are healthy and safe. So I am Dr. Neeta, an obstetrician and gynecologist, and welcome to yet another episode of Dr. Neeta's Medical Clinic. So today I'll be telling you some do's and don'ts before you get pregnant. So if you want to hear about that, do keep watching the video. Now the first point is mental and emotional maturity. So before planning for a baby, you have to be both mentally and emotionally mature, because taking care of a baby, a newborn baby, is a huge responsibility. You have to sit with the baby with many nights. The baby will keep crying. You have to change the diapers. You will not get enough sleep. You'll have to continuously keep breastfeeding. Your freedom will be sort of, you'll feel your freedom is getting curtailed. Wherever you go, you'll have to take the baby with you. And all these problems can be overcome if you are mentally and emotionally mature. And if you are not, then postpartum blues is a very real possibility. And in fact, if you are mature, you can enjoy the entire process. Second point is that the financial status has to be okay. Now giving birth to a baby is going to involve some amount of money, and you need to be financially okay, because one, your baby needs the best, and two, eventually you have to plan the baby's delivery, you have to plan the education for the baby, and you also have to plan all the essentials for the baby. So all this needs some amount of money. So financially, one does have to be stable. Now the third point is the space between two pregnancies. Now the space between your two pregnancies should be at least 3 years, because your body has to replenish the calcium, iron and protein which it has given to the first baby in the first pregnancy. Again, this depends upon the age of the female. If you are already 35 or 35 plus, then you cannot keep so much gap as much as 3 years between the two babies. But if you are in your early 20s, then you can take a gap of 3 years between your two babies. Now the fourth point is you have to stop contraception. As soon as you decide that you want a pregnancy, whatever contraception you are using, now if you are using copper T, get it removed. If you are using condoms, then stop using condoms. If you are using oral contraceptive pills, then at least stop the oral contraceptive pills and wait for at least 3 months before getting pregnant. The fifth point is folic acid supplementation. Now folic acid supplementation is essential 3 months before you get pregnant and 3 months into the delivery at least. This folic acid supplementation helps in preventing neural tube defects like spina bifida or anencephaly in the baby. Now the sixth point is avoid smoking. Now smoking is definitely a big no-no, because this smoking before pregnancy or during pregnancy can cause growth retardation, it can cause preterm labor, and it can cause a less intelligent baby. So smoking you definitely have to stop. The seventh point is avoid alcohol. Now even alcohol is a big no-no, because alcohol before pregnancy and during pregnancy can cause an abnormal baby and even mental retardation. So alcohol you have to stop. The eighth point is immunization status. Now finish all your vaccine updates. Visit your gynecologist and finish all your vaccine updates like mumps, hepatitis B, rubella, tetanus. And then after you finish your immunization, at least wait for 3 to 6 months before you get pregnant. The ninth point is stay away from infectious diseases. Now avoid getting close to people who are suffering from German measles or rubella, mumps, then measles and chickenpox, because all these diseases, if you are unknowingly pregnant, can affect your baby and cause an abnormal baby. Now the 10th is if you have any medical disorder before getting pregnant, then that has to be controlled. Now I will be taking you through a few medical ailments. First is diabetes. Now in case you have diabetes, your fasting blood sugar, your post lunch, 2 hours blood sugar, and your HbA1c levels should be normal at least 3 months before planning pregnancy, or the chances of abnormality in the baby will increase. In case you have a thyroid disorder, your serum TSH levels should be within 2.5 milliunits per liter. In case you are on anticoagulants due to any conditions like valvular disorder, then these anticoagulants should be changed to ones which do not harm the pregnancy. If the woman has a heart disorder, then she has to be treated before getting pregnant, and sometimes surgical correction may be necessary. Now, in very rare cases, if the heart disease is too severe, then sometimes she may be advised against pregnancy. If you are being treated for epilepsy or fits, then make sure that you are on drugs which do not harm the baby. If you are a patient of hypertension, then again make sure you are on drugs which do not harm the baby, and your hypertension has to be controlled before getting pregnant. Now, in case of mental illness, if you have any mental illness, then please do get treated. Visit a psychiatrist, and if you are on drugs, then make sure that the drugs are changed so that they do not harm the pregnancy. So 11th point is genetic counseling if it is necessary. Now, if you have a history of abnormal child in your previous pregnancy, or if you have a history of abnormal child in your family, or if you have a family history of sickle cell anemia, thalassemia, any mental retardation, if you are of an elderly age, or if you have again a family history of hemophilia or cystic fibrosis or muscular dystrophy, then you have to visit a genetic counseling center and get yourself counseled so that you know what the chances your present baby has of getting such an illness. 12th point is exercise before getting pregnant. Now, obviously you do have to keep fit and you have to exercise well, at least even walking before getting pregnant. And if you're obese, it is better to lose weight, because one, losing weight itself will make your hormones work good in order to get yourself pregnant, and secondly, losing weight will also decrease the burden on your body, because when you get pregnant, obviously you're going to put on around 10 kg, and so it is advisable to lose weight before you think of getting pregnant. The 13th point is, while handling chemicals, wear gloves. Now, if you are handling harmful chemicals like cleaning materials, or you are handling insecticides, then definitely wear gloves, especially before you fall pregnant, because you don't want to harm the baby with those insecticides. 14th point is avoid contact with cats. Now, the cat feces may contain an organism called toxoplasma, and if you are having close contact with cats, you may get it, and this may lead to a condition called toxoplasmosis, which is again harmful for the baby. 15th point is that avoid x-rays when you are planning for a pregnancy, as if you are unknowingly pregnant and you end up taking an x-ray, it may harm the baby. And the 16th and the last point is that any complications which you have had in your previous pregnancy can recur in this pregnancy, so you have to be extra careful. And what such things can recur if you have been on hypertensive or diabetic in your previous pregnancy, if you had any forceps or vacuum delivery in your previous pregnancy, if you had a cesarean section done in your previous pregnancy, or if you have had complications like lot of bleeding after your delivery, all these problems, or if you had a preterm delivery, then all these problems can recur in your present pregnancy, and so you need to be extra careful. So this is it for now, folks. If you have any questions on this topic, or if you want to hear about any particular topic, do put it in the comment section. Thank you for watching this video, and I would like to just make a gentle request to, even if you have liked the video a little, please like the video and comment on it and share it with your friends and relatives, and do subscribe to it. Now, subscription is absolutely free, folks, and all you have to do is to click on the subscribe button below the video and then on the bell icon and then all. With this, what will happen, whenever I upload a video, you will get an instant notification and you can watch the video. So stay healthy, stay safe, stay happy. Bye bye, dears.